Today on Cancer Buzz, an award-winning program that allows patients with cancer to get cutting-edge treatment close to home. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. This episode is the second in our 6-part series on the 2024 ACCC Innovator Award winners. The 2024 ACCC Innovator Awards recognize programs and practices that improve cancer care delivery and the patient experience. The goal is to showcase incredible innovations in access, quality, and value, and provide replicable solutions for other cancer programs and practices. In the fall at the ACCC National Oncology Conference, you have the unique opportunity to connect and learn from the 2024 ACCC Innovator Award winners. Today's guest joins us to talk about their innovation entitled Implementation of a Bispecific T-Cell Engager Therapy Program at a Community Cancer Center. Courtney VanHouzen is a pharmacist at Munson Medical Center in the Cowell Family Cancer Center in Traverse City, Michigan.
Being able to utilize, a novel treatment like bispecific therapies in the community setting, I think has been the goal. But actually making that happen and doing it safely is a whole other process. And so that is really the focus of our project is, how to implement a bispecific in the community setting, and everything that entails in terms of the REMS program requirements, and how can we offer this as a treatment option to patients in their, hometowns and their communities.
Can you expand on the focus of your program?
Our big focus was how do we ramp these patients up safely inpatient, and how do we work with inpatient medical groups to facilitate the administration of these products and management of these patients, because logistics-wise, all of our medical oncologists are outpatient. We don't have any inpatient medical oncologists. So, they're not at the hospital 24 hours a day, right? So we needed a lot of education and communication with our provider groups. And I think that we were really set up well to do this at Munson Medical Center. We're very lucky to have very open and receptive communication between, our ER provider groups, our hospitalists, our intensivists in the ICU, all different groups that we would need to be able to potentially coordinate with to care for these patients.
What can listeners expect by attending NOC in person?
There's a reason, right, that not every community cancer center in America is doing this therapy right now. There's a lot that needs to be done, and I'll be able to really get into that and speak to it, and hopefully, be able to give other community cancer centers the ability to replicate this in their own communities and be able to offer this continuity of care for patients who would otherwise be referred to large academic centers, potentially have to travel and be away from their support systems, all things we ideally would like to offer patients.
Do you have any final thoughts to share with your colleagues?
While this is not an easy thing to make happen, it's possible to make happen and possible for it to be done safely and effectively. And that's what we're trying to be able to show community cancer centers across the country, that they're able to do this and able to offer this therapy to their patients. And, I think that's a wonderful thing and something that can really be said for equity. All these new therapies, it's sometimes hard to feasibly make them happen in community centers, but I think bispecific therapies is one that this is a niche for, and one that hopefully will be able to help other community cancer centers be able to offer their patients.
VanHouzen will share how this innovation was developed and implemented and its benefits to patients and providers at the ACCC 41st National Oncology Conference, which will be held October 9th through the 11th in Minneapolis. You can find a link to register in the show notes. Finally, make sure to follow this channel on your favorite podcast player so you don't miss out on the next award winner in this series. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.